Hello, my name is Dr. Victor Chedid. I'm a gastroenterologist and an IBD specialist at the Mayo Clinic in Rochester, Minnesota. And I take care of patients with inflammatory bowel diseases and specific interests in taking care of individuals who identify as LGBTQ who have IBD. And I see patients in the Pride Clinic for IBD here at Mayo Clinic in Rochester. June is Pride Month, and in recognition of those who are members of the IBD community and members of the LGBTQ community, we are offering this brief educational resource. The foundation posted a brief survey to collect questions from our IBD patient viewers who are part of the LGBT community, and we had really a lot of great questions submitted. And I will attempt to answer some of them. We chose the top 6 questions, and I'll attempt to answer them here today. Many questions were very specific, so we may have combined or generalized some of the questions for the benefit of the whole community. So to begin with, the first question was about disease information. We were asked, can you clarify the difference between Crohn's disease and ulcerative colitis? Thank you for that question. And it's important to recognize that inflammatory bowel diseases is an umbrella term that includes inflammatory conditions on a spectrum of Crohn's disease and ulcerative colitis. The difference between those two conditions is that ulcerative colitis, by the name, causes inflammation in just the colon, and it usually starts from the anus and extends from the rectum up into the descending colon and goes more proximally all the way towards the cecum. So it is inflammation that involves the colon and can involve any segment of the colon, but it always starts from the anus upwards. Usually the inflammation is in the mucosa, so in the inner lining of the colon. And it can cause symptoms such as severe diarrhea or bloody diarrhea, sometimes abdominal pain and cramping, but the most common symptom is bloody diarrhea. As opposed to Crohn's disease, we always say can involve anywhere, it's inflammation that can involve anywhere from the mouth all the way to the anus. And it can cause different phenotypes or different features that are very specific to Crohn's disease. The most common site where Crohn's disease is present is in the ileocecal area, meaning the last part of the small intestine, which is the terminal ileum, and the first part of the colon where the small intestine meets the colon. This is the most common area, but that doesn't mean that that's the only place it can involve. As I said, it can involve anywhere from the mouth to the anus. With Crohn's disease, patients might get narrowings in their colon or in their small bowel. They can get what we call strictures. They can get fistulas, which is a communication between one part of the intestine to another part of the intestine, or sometimes it could be a communication between one part of the intestine to another organ, like the vagina or the bladder, or sometimes out to the skin. So these are the major differences that we see between Crohn's disease and ulcerative colitis. Moving on to question 2. Again, it's about disease information. The question states, what type of symptoms occur within the GI tract? And are there symptoms outside of the gut that we should be aware of? First of all, symptoms that can happen with inflammatory bowel disease include diarrhea, bloody diarrhea, abdominal pain, sometimes significant bloating if somebody has narrowing in their intestine, or sometimes you could get bowel blockage, which causes inability to pass any bowel movement or gas, a lot of distension of your abdomen, or you feel that it's protruding, and it can cause symptoms of nausea and vomiting. Other symptoms can include pain around the anal area, an abscess around the anus or around the rectum, and these are more common features for Crohn's disease and not ulcerative colitis. Symptoms outside of the gut That is a very good question because inflammatory bowel disease can be associated with what we call extraintestinal manifestations, meaning manifestations that are beyond the intestine or beyond the gut. And these are symptoms that are usually associated with the IBD, and they could be either symptoms that parallel the disease activity. So if the colon is inflamed, these symptoms will be happening at the same time. And there are other set of symptoms that do not parallel the disease activity, meaning even if the colon is quiet and is under well control, or the GI tract, there's no inflammation in it, these conditions can still be active. So these are things that are related to joint pains or arthritis. They could involve small joints in the hands or fingers or wrists or elbows, or can be with bigger joints like the knees, the hips, and sometimes can involve the spinal cord and the lower back and the sacroiliac joint. Other symptoms include eye symptoms. Somebody can get inflammation in their eyes or iritis or uveitis. Somebody can get oral ulcers or aphtha in the mouth. Other symptoms can be skin rashes, something called erythema nodosum, and pyoderma gangrenosum. These are skin conditions that could be seen with inflammatory bowel disease. And there are other less common extraintestinal manifestations that we see um, that sometimes can involve the liver, something called primary sclerosing cholangitis or PSC, and other blood features or bone features that are much rarer. Going on to question 3. This question is about specific symptoms, and that question relates to I often experience mouth sores and ulcers because of my Crohn's disease. Is this common, and what can I do about it? So that's a very good question. And as I was saying in question 2, there are multiple extraintestinal manifestations of Crohn's disease or ulcerative colitis. With Crohn's disease, we tend to sometimes see oral ulcers or sores or aphthous ulcers. This is maybe common in around 5 to 50%. That's what I've seen in the literature. So it is quite a common manifestation of Crohn's disease. And some patients, it gets better when their Crohn's disease is under better control with their Crohn's disease medications. Sometimes, if that persists, you might need additional topical therapies or medications that you can apply to the mouth, which I highly recommend that you talk to your IBD provider about these if the ulcers aren't getting better with just the Crohn's disease treatment. Question number 4. That's about intimacy. Can I be sexually intimate with my partner normally with IBD? What if I had a surgery, experiencing a flare, or having other types of complications like perianal, vaginal, or other fistulas? That is a very important question. And many a times our patients do not share that with us voluntarily. So it falls onto the doctor or the provider who's seeing you to have that discussion with you and create that safe space for you to have that discussion. Because we recognize that talking about sexual intimacy is very sensitive topic, and it's not very comfortable to discuss, whether it is with your provider or the doctor you're seeing. So I appreciate that question right now. So the first part of the question is, can I be sexually intimate with my partner normally when I have IBD? What we know is that IBD can impact sexual drive or libido. And when somebody is flared up and inflamed, they don't have the sexual drive or the libido, or they don't want to have sex. And that is usually common in somebody who's inflamed. So it's not abnormal that when you're feeling crummy from an IBD, you don't feel up to having sexual intimacy. But the fact is that IBD should not be a limiting factor for you to be sexually intimate with a partner or multiple partners, as long as you are practicing communication with your partner and knowing how to say, knowing how to feel comfortable to talk to your partner about consent and what you're okay with, what you're not okay with. And many a times, patients ask, do I need to disclose my IBD status to my partners? To be honest, if it's somebody who you're having a sexual encounter with, but not a long-term relationship with, you don't need to disclose that point to them if you're feeling up to having a sexual encounter with that person. And if it's your long-term partner, then they might want to be on the journey with you to help you. So it would be important to maybe disclose your IBD diagnosis to them so that they could be a good support to you as well. Now, if somebody is experiencing a flare, they, as I said, might not want to be sexually intimate. If they have had surgeries, it depends on if they have an ostomy. That sometimes can impact somebody's self image. And typically, if somebody has an ostomy, they can have normal sexual intimacy, and this shouldn't be a limiting factor for them to have sexual intimacy. And then when somebody has perianal disease or a rectovaginal fistula or perianal abscess, that can be an impediment sometimes to having sexual intercourse, whether it's penetrative vaginal penetration or anal receptive penetration. That can be impacted by having a perianal fistula or perianal abscess or rectovaginal fistula. So I would recommend that you have that discussion with your doctor, because it would be based on a case by case basis. They can give you recommendations, but sometimes you might need to find alternatives to vaginal penetration or anal receptive intercourse. And you might have to find alternatives such as using sex toys or fingers or other modes for finding pleasure. You can discover that between you and your partner or you and yourself, and that's totally normal and safe to do so, so that you can know what your um, um, boundaries are and what is okay with you and what is not okay with you. Moving on to the next question. Question number 5 was about intimacy. And the question is, when is it okay to tell my partner or a new friend about my disease? What can I say to put us both at ease? So I am somebody who's very much into having open conversations with people, but I recognize that many times there are consequences of having open conversations. So I recognize that when somebody has IBD, that they might be uncomfortable sharing their diagnosis with others. And I believe that if you have a partner who's supportive, that having that discussion with them about your diagnosis will help them understand you better as a whole person, because part of who you are is having inflammatory bowel disease, and they're going to be with you on that journey. So I believe that disclosing this with a long-term partner is something that is welcome, and you might see a better version of your partner, a better support from that partner, if you disclose that information. But at the end of the day, you are the leader of your own journey, and you are the person who decides who you feel is a safe person to disclose the IBD diagnosis to, and who is not a safe person to disclose it to. And that is totally fine. You follow your gut instinct. Many patients who identify as LGBT and who have IBD say that they have used um, similar strategies for coming out as lesbian, gay, transgender to their family or partners, as they use these same strategies to come out as having IBD. And it's such a unique thing to be part of the LGBT community and experience the the experience coming out, and then using those same strategies to come out as having IBD. The other part of the question is, what can I say to put us both at ease? And to be honest, it's just um, an honest discussion. If that person is not going to be uh, comfortable, it's you who's dealing with the IBD. So that might not be a person that you want to keep in your um, vicinity or your pool of trusted people or chosen family, if I may say, because to, yeah, moving on. Question number 6, communication with your doctor. The question is, how can I bring a sensitive question to my doctor if they are not familiar with the LGBTQIA community? That is a really important question because most all doctors, I believe, went into medicine with the goal to improve patients' life and to take care of everybody, regardless of their sexual orientation, gender identity, race, ethnicity. So all doctors have the duty to take care of everybody. But I recognize that being part of the LGBT community, there are certain topics that some people might be uncomfortable with, and there's a lot of negative energy right now in the around the country that has anti-LGBT rhetoric. And I can't say that all physicians are immune from this, from what's happening in the country. And so I believe that if you are comfortable disclosing your sexual orientation or gender identity to your physician, that will help improve your care and provide you with the holistic care as the beautiful person that you are who has IBD and identifies as LGBT. And when I see patients in clinic, I try to create the safe space for them by, first of all, introducing myself, identifying what my pronouns are, and then asking the patient what their pronouns are, how they would like me to address them. And then I would try my best to get to know them as a person beyond what their IBD, beyond just their inflammatory bowel disease diagnosis, get to know their hobbies, their interests, who, if they're partnered or not, what they do for sex, what they do for fun. And by creating that, it makes it a more interactive visit with the patient. But not every physician would do that. So if you are somebody who wants to have these discussions with your doctor, then I say just ask. And it's up to the doctor to go do their research and get back to you with answers if they don't know. And there's nothing nicer than a doctor who tells you, I honestly don't know, but I'm going to go read about it for you. Uh, that's better than somebody who could just make up answers on the fly. Um, and and basically, I say, if you're honest with your doctor, if you feel that you have the safe space with your doctor, you can bring up any sensitive topic with them, and you can, if they didn't know the answer, we don't judge the doctor or the provider. Uh, if they're going to do their due diligence and do their research and come back to you with an answer, or ask a friend and come back to you with an answer, and that's totally okay. But I say just ask whatever comes to your mind, because that is important to you. And as physicians and providers, we have to make sure we do the best for you. So that concludes all the questions, and I thank you for bringing them all up, and I was very happy to answer them. I want to let you know that the Crohn's and Colitis Foundation is here to help. As IBD patients, you may have other questions or may be in need of support and connection. We are happy that many of you are part of the foundation's existing affinity groups, and know that there is more help and resources available to you. If you have more questions, please contact the IBD Help Center and the information shown. You can also explore many topic areas by visiting our website. Thank you so much for joining us.